Hello, doctor.
Hello, how can I help you?
Doctor, my condition isn't very good these days.
So could you tell me more details about your recent condition, just so I can get it better?
I think I have a problem with urinating. I always feel sudden need to urinate more during the day than usual. I would say maybe 20 to 25 times.
Oh, I see. So how long is the interval between each urination?
About every 10 to 20 minutes.
So does this disrupt your sleep? I mean, do you often have to wake up at night to pee or something?
No, it doesn't, but it really makes me uncomfortable during the day.
Oh, okay. So, besides going to the bedroom many times a day, do you have any other symptom?
I feel pain when peeing and pushing. Beside that, I have no other symptoms.
I see. So, according to your symptoms, it can be diagnosed initially that you may have polyuria, which means a urinary disease. But this is just an initial diagnosis and can be a definite conclusion. Okay, now you will have to take some specific tests to get to know about your disease better, okay?
I got it. Shall we start now? May I ask for the results, doctor?
It's kind of strange that you don't have any sign of having polyuria. But to be sure, I will give you some medicine and we'll observe for a while to see how the situation goes. But if you experience any strange symptom while taking the medicine, you'll have to stop taking it or go to the clinic, okay?
Yes, thank you, doctor. Hi, doctor. I'm here again for my freaking peeing disease. I just can't take it anymore. I met multiple doctors, took multiple treatments, but seems like there's no work. I felt scared, insecure all the time, and exhausted. And I'm really disgusted myself.
Keep calm, sir. Please don't say that. So I see that it's still happening, but do you get any physical pain included?
No, but I don't feel like my mental health is good. I'm just getting worse day by day. Since my father's death, my life has turned into a biggest mess, even though it has been a mess before when I was a kid.
Oh, I see. So, may I ask you a question that when the exact time did the symptom appear? Like, did it nail to any event or something?
I think it started after my dad passed away. I don't even know what to say, but I didn't have a really good relationship with him. Or do you mean he left a curse on me or something to make me have a wretched life?
Oh no, I didn't mean that. It just want some information about your medical history. So, I think you should meet a psychologist for healing yourself first. Right after you got a result, you may come back to meet me later for medical treatment. Is that okay?
Hope this could be work, cause I'm fed up and tired of this.
Don't worry, I can help you with the information of some psychologists in our city. Oh, hope you be well soon.
So, can you tell me something about your life?
My life has been a mess since I was a kid. After my parents divorced, I didn't have a good relationship with my father. He died 4 years ago, but his death didn't cause any little pain to me. Oh, but now I realize my urinary symptom has been since then. Yeah, I used to be sexually abused, kinda improper touching, and I had lived under a stressing family environment with constant verbal and psychological abuse toward me and my other members. It had still happening until my adolescence. Then now I quit my job, stopped meeting my friends, and isolate myself at home for over 2 years just focusing on solving my peeing symptoms. I was scared, insecure till now, and I feel that I have no values. And it's also influencing my interpersonal relationships with others. Is my life worth living?
According to Mr. Nam's medical records from his previous physical doctors and after session of working together, we have made a conclusive diagnosis for the patient. Because Mr. Nam's frequent urination persisted for a long time, along with taking medication to treat polyuria for too long without any signs of improvement, we conclude that, according to DSM-V, there is a presence of severe and persistent somatic symptom disorder. These urinary symptoms over the course of 6 months created a great discomfort and anxiety, negatively affecting various areas of life. So, what is somatic symptom disorder? Somatic symptom disorder, which is SSD, is characterized by somatic symptoms that are either way very distressing and result in significant disruption of functioning, as well as excessive and disproportionate thoughts, feelings, and behaviors regarding those symptoms. To be diagnosed with SSD, the individual must be persistently symptomatic, typically at least for 6 months. Somatic symptom disorder is diagnosed when a person has a significant focus on physical symptoms, such as pain, weakness, or shortness of breath, to a level that results in major distress and/or problem functioning. The individual has excessive thoughts, feelings, and behaviors relating to the physical symptoms. The physical symptoms may or may not be associated with the diagnosed medical condition, but the person is experiencing symptoms and believes they are sick. That is not faking the illness. SSDs often begin before age 30 and common in both children and adolescents, occur across cultures. Common SSD symptoms include dry mouth, fatigue, hot or cold sweats, dizziness, headaches, trouble concentrating, trouble with memory. In addition, SSD can also affect the nerves, heart, lungs, muscles, and abdomen. One of the main causes of SSD may be childhood neglect, sexual abuse, chaotic lifestyle, and a history of alcohol and substance abuse. As the preschool years, SSDs may develop as a stressful event or a major change. As with adults, children and adolescents can express the stress through physical symptoms rather than through emotions or thoughts. Some children, such as those with difficulty putting feelings into words, or those who associate stigma to psychiatric illness, seem to be especially. Most people experience physical or somatic symptoms as part of daily life without having a medical disease. For example, many people had a headache before a stressful event or experienced stomach upset when asked to give a public speech. In Mr. Nam's case, because of a lot of traumas and stress in the past, his body reacted to the problem by leading to his frequent urination. Related to SSD, there are also some related disorders such as illness anxiety disorder, conversion disorder, functional neurological symptom disorder, psychological factors affecting others' medical conditions, factitious disorder. To understand more about SSD, you can scan the following QR code on the screen. So now, let's continue the story.
Psychologist prescribes medication-induced cognitive behavioral therapy, also called CBT. The idea is to help Nam face his somatic symptoms, express frustration, emotions, and develop alternative strategies to address his feelings. Psychologists also combine with psychodynamic therapy, where the therapeutic alliance plays an important role and is solidified through empathy with Nam's suffering. The therapist decided to begin with individual, expressive psychodynamic psychotherapy with a focus on object relations twice a week in 45 to 15-minute sections. During the first 6 months, the psychologist included behavioral techniques focused on urinary symptoms. This technique consists of empty the bladder every 2 hours, going to the bathroom only to wash his hands and or face, and performing jaw exercises. The urinary symptom occurs with less frequency until it's fully resolved after months of treatment. Besides, Mr. Nam starts enrolling in university, takes responsibility for his school expenses and his treatment, and gradually becomes involved in social and recreational activities. He continues with psychodynamic psychotherapy to keep working on his evasive and dependent personality traits, which contribute to the onset of the physical symptoms and the subsequent personal and professional deterioration.